Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey, welcome back to Between the Sheets. I'm really excited for today's topic. We're going to talk through sex toys and different things that we can do to spice up the bedroom. I have a fantastic guest on with us today, Dr. Amy Pearlman. She is a board-certified urologist and co-founder of the Prime Institute in Miami, Florida. Welcome.
Thanks, Stephanie. It's so exciting to be here with you today.
Yes, I first got to listen to you speak when I was at Ken Mitchell's gynecology conference in Nashville, and just was so impressed with not only your knowledge, but just your passion for this. And I was just so excited to get you on the podcast and have a chat today.
Awesome. Well, it's good to see you again, Stephanie.
Yeah, thanks. So talk to me about how did you develop this part of your practice? Because this is something that I would love to incorporate more with my patients.
That's what I'm really excited about actually in 2025 is helping other healthcare providers really understand how what I would call medtail can play an important role in their practice. And medtail is really a term that I learned from a colleague of mine, Nicole Lineback, and she is in the retail space. So what is a urologist doing in the retail space? Because throughout our training, you've done a lot of training, I've done a lot of training. We are not taught really the business of medicine or where retail could even play a role in patient care. So it was about, I would say, 5 years ago at our Sexual Medicine Society of North America conference. And this was in Arizona. And I remember walking around the industry hall and I connected with a gentleman, Jeff, who owns a company called Pearlman, and he's based in California. And his product is really to help men last longer. He has a topical delay spray and wipes for premature ejaculation. But what his company also does is they also sell different sexual wellness products. And like I'd known about vibrators before this, but it certainly didn't enter into any of my discussions with patients. I mean, I would barely even say that word myself. With my friends, it wasn't something that we spoke about on a regular basis. And as a men's health specialist, there are so many therapies that I've recommended to patients that I never had the opportunity to try myself, which is kind of like the one downside to being a men's health specialist. On the upside, it meant that when I would ask my patients questions, I asked them questions for the sake of truly understanding their experience because I can't have that same lived experience. But that's not the case with sexual wellness products. And so I asked Jeff to send me some of the products that he recommends. And so I remember it was like a kid in a candy store. It was like an early Christmas or Hanukkah gift. And I got a big box of different wellness products and I tried some of them out. And I realized very quickly, Stephanie, the value of sexual wellness products. And, at the time, I didn't have any concerns about my body. I didn't have any concerns about the function of my body. And so I realized that these products really are not limited to people who have a dysfunction or really any problem, but they can really be used for people at any place in their sexual exploration. And what I've learned over the years, because most of the people I interact with are patients in the practice, is how what we would historically consider to be sex toys and pleasure products can help and really have a purpose in the medical setting. So my job as a urologist is in many ways to medicalize what has often been a very taboo and stigmatized topic and to really present it in a way that can take people from purpose to pleasure, which is what I have behind me right here is in my office at Prime Institute in Miami. I have an entire room dedicated to sexual wellness products.
That's amazing.
Yeah. So that's kind of where that began.
Yeah, that's great. And it's interesting because I remember when Pure Pleasure came out and adamandeve.com became a big thing. So it has become a little bit more mainstream, a little bit more acceptable to talk about these things. But you're right. In the medical community, we haven't really talked about this with our patients and how to enhance their pleasure. With ED, I certainly talk about constriction rings a lot or a penis pump. But as far as just using a tool for pleasure in and of itself, we don't discuss that a lot.
No, we're so focused on what is your chief complaint? What is your problem? Whereas if someone could have fine function and they could be having good sex, but if they want to have different sex,
Yep.
or if they want to have better or just good sex, right? That's where these products can play a role. So it's, in some ways, I'm medicalizing. And in other ways, I'm doing the opposite of pathologizing. I'm saying you don't actually have to have a problem.
Right. Yeah. No, it's so true. I mean, there's so many ways that we can improve our enjoyment in our sex lives, try something new, reinvigorate a relationship. And so I think that's where a lot of these tools can come into place. I know that you are, really big in the men's world. So talk to me about some of the tools that you're getting your guys to use.
Absolutely. So we're going to start by talking a little bit like on the purpose side. So helping some of the men that might see us in a healthcare setting.
Yeah.
And let's see. So we'll begin with this device right here. So this is a company or a product called the Myhixel, and it is a trainer for men who have premature ejaculation. So what this device actually does is it mimics a vagina. This is a heating component, so it heats this to the temperature of a vagina. This is a reusable device, so this part would actually just come out. This is actually one of the older iterations. The newer iteration actually doesn't have any cords in here. And then the person would actually just wash this out. Okay, so it's like a sleeve.
Yeah.
And there are sensors in here that will actually track how long someone is lasting based on movement. So if you look at the research in the premature ejaculation space, oftentimes the data that we're looking at is, they're timed measurements on how long a man is able to last inside of a vagina. Can you imagine how difficult that must be to track on a stopwatch how long someone is lasting, especially if they're lasting not very long, like a minute or 2 minutes, right? And so I like this because it takes some of the pressure and the work off of the person to actually have to time himself. What I also like about this technology is it allows a man to train his body outside of being with his partner. So rather than having to train with his partner, he can train with a device. So that's one thing. Number two is a device alone is not enough. It's the device plus cognitive behavioral therapy to help train the man. But if you think about in our busy urology clinics, we don't really have the time nor the expertise to teach people cognitive behavioral therapy. So what I like about this technology is it allows the person to learn those techniques, but we don't actually have to have the time or expertise to teach them. The application goes through that with them. The third thing I like about it, because a lot of guys may not be excited about some at-home training, but it is done in the comfort of one's home, and it really gamifies the experience. It tries to make it a little bit more fun and enjoyable for the patient by gamifying it using a smart application. So no one really loves having the conversation when it comes to premature ejaculation, but I would consider like really first-line therapy for PE to be behavioral modification. I've been surprised just by talking to patients over the years. Men actually have incredible control over their bodies. They just don't know it yet. So part of my job is to help them understand what technologies can they use in the comfort of their home to better understand and train their bodies.
Yeah. No, that's fantastic. And I love that it warms up too, because there's nothing like a cold sleeve with some cold lube in it to really get you turned on.
Exactly. So I'm excited about this technology. What I also like about it too is the company is out of Spain and they're actually doing a lot of research on their product. So I like that they're trying to show people that their product actually has evidence to support its use. And they're really on the cutting edge of the treatment for premature ejaculation. We have other treatments for PE. We have the product I had mentioned, the Promescent topical delay spray and wipe, which I think is great. So I'm never talking to patients and saying this one is better than that one. It really just depends on what they want to do. They could use a topical therapy in one moment, but then while they're using that in the background, they might be retraining their body. So maybe 5 years from now, they don't need to use some topical anesthetic.
Yeah.
But the reason why I'm also really fascinated with this innovative technology in the PE space is I do not like SSRIs for the treatment of PE. And I know that a lot of my colleagues use them. I used to prescribe them for patients. But over the years, I've seen patients, men and women, with what we call post-SSRI sexual dysfunction, or PSSD. And that's when people can have persistent or prolonged side effects after the use of SSRIs, even if they just take it for a couple of days. And I have no cure for that. I literally am throwing the kitchen sink at those patients. So if there's a therapy I can prescribe someone that could potentially have permanent or long-lasting consequences for which I have no cure, it really takes a lot for me to prescribe one of those medications. And that's why I'm really fascinated by the innovation in the PE space.
Yeah, that's amazing. You're right. The SSRIs have so many side effects, and if you do use it long term, you've got to be weaned off very, very slowly. And there's so many things that need to go into using those that it always makes me hesitant to use them as well. So this is a fantastic tool.
Okay, so this is one, and it's funny because I have this in my office, and so I'll just have it on the side, and people will look at it and they'll say, "Oh, that's cool. What is that?" And then I open it up and I explain it, and you should see the looks on their faces.
Right.
But people are curious. And even though the majority of my patients may not need a device like this, I do think it's really beneficial, especially for young men as they're kind of exploring their sexuality. Premature ejaculation tends to be a pretty common phenomenon that we see.
Yeah. Yeah, I can imagine. And I see it in my clinic as well. And the other thing that I see a lot with the younger guys is an influx of ED in younger men. And I think a lot of that comes from over masturbating or watching too much pornography or a very specific type of pornography that then they can't engage with a partner. Yeah.
Absolutely. I think all of us in our clinics, we're seeing the influx of young men with erectile dysfunction, which sometimes can be some of our more challenging patients. I think it's easier for us to oftentimes see the 70 or 80-year-old guy who comes in with ED because he's kind of like, okay, I'm like 70 years old, I'm having some issues. And he tends to be pretty open for the most part in terms of trying a lot of different therapies. But when you get a 20-year-old guy in the office, he doesn't want anyone else to know that he's got issues. So he tends to be a little bit less open to trying some of the other therapies. And so that can be a little bit challenging. And one of the other challenging factors really in the young men, but also really men of any age, is differentiating, is this like a performance anxiety issue, like something, that's like mental health related, or is it physical? I really don't like trying to separate the two because even though it might be, I would never tell someone it's in his head. Because I don't believe that it's like in someone's mind, but it might be in his brain. And the brain ultimately is the largest sex organ. And I think a lot of men truly do understand that, as do women. And so the question becomes, how do you make sure that someone's plumbing is still working? And really understanding someone's nighttime or nocturnal erections is the best way of understanding if someone's plumbing is working in the penis. And historically, that's been a little bit of a difficult thing to do. We've had Rigiscan for a while, but it's not easy to get your hands on Rigiscan. And there aren't that many clinics these days that actually offer that technology. So even though it's like, in our algorithm, the practicality of actually using that technology is not very practical. And then we can do a Doppler in the office, but and that certainly has its value. But I look at a Doppler as looking at that person at one point in time after giving him a very powerful medication to induce an erection. So if that guy is not using that injection like of Trimix at home, that doesn't tell me what's happening to the penis when he's in the comfort of his home and taking something like Viagra or Cialis. So that really opened up this great need to understand nocturnal erections in the comfort of one's home. And that's where a company called FirmTech has really changed the landscape. So let me grab a product to show you all.
Yes. And for anybody who's just listening, you're definitely going to want to pop over to the YouTube channel for today because Amy is showing us all of these products.
So let's talk about the devices that are now really changing the landscape in terms of understanding someone's plumbing in the penis. So the company FirmTech has come out with this device right here, and it is essentially a smart cock ring or erection ring. And we're trying to change the nomenclature because oftentimes when we think about this ring that puts pressure on the base of the penis, what do we call it? A constriction band. That's not a very sexy term, And if someone said, oh, we're going to put like a constriction band around the clitoris or around like the nipple or something like that, I would be like, that sounds terrible.
Yeah.
So I think that just like in the sexual wellness space, we're calling it sexual wellness rather than like adult store or novelty. I think that opens up this curiosity for people. And so I hope we kind of start changing our language a little bit to say like an erection ring, because that
Yeah.
sounds a little bit better, right?
Right.
So there are so many erection rings on the market, and a lot of them look like something like this, where you need to wait until you have a full erection before you put this on because it will not allow additional blood in the penis.
Right.
These can be a little bit cumbersome, and depending on the one that you get, sometimes they're a little bit more difficult to stretch out. And I kind of think of them literally as a cock block because I don't know, it is a bit cumbersome to have to wait until you get the full erection and then like get a ring to put it on. So full disclosure here, Stephanie, I am on the advisory board for the FirmTech company.
Okay.
I do know a lot about this product. But I'm on the advisory board because I do really like the product. So let me be clear about that. And so the way that this ring works, and this is their max PR ring, is I find it easier for someone to put on. So what the person would do is they would drop their testicles in here, and then it's really designed like the back of a bra. So it just hooks in like that. So one band goes around the back part of the scrotum and the other band goes around the base of the penis, and it can be adjustable depending on how tight they want it to be, let's say around the shaft of the penis or around the scrotum. We do find that some people do like some of that testicular engorgement. The reason to have the ring around both is really to keep it in place is the biggest reason for that design. Now, the nice thing about this ring, Stephanie, is it's made out of a material called elastomer, so not the typical silicone. And elastomer is a little bit looser than silicone, so it actually can be put on the penis even when the penis is not erect. So let's say like during foreplay, and it will still allow blood flow in and just helps keep the blood in the penis.
Okay.
And it can be worn up to an hour. So you do have some time limitations with some of these rings that are tighter, where really you don't want them to wear for longer than 20 or 30 minutes. This can be worn for longer. So this is what we would call more of like a dumb device. It's used to help keep blood in, but is not going to provide data. Which is different from this device here, which is that smart ring that I was discussing. This ring is also made out of elastomer, so it can be put on when the penis is completely flaccid. It allows blood in, blood out. It has a pressure sensor and a strain gauge in this device. And so the man would similarly drop the testicles in here, hook that. Again, it goes around the base of the scrotum here, around the base of the penis. And what the guy can do, he can wear this during sexual activity to help keep the blood in, but it also helps with data. So it will actually track number of erections, duration of erections, and firmness of erections overnight or during sexual activity. And then via Bluetooth, it will connect to one's smartphone and it will graph it out. So where I find this particularly helpful is, I had a patient recently. He's a young guy. He's in his 20s. He's healthy. And he was having some concerns about ED, but nothing was really that bad. I had started him on Cialis. He loved the Cialis, but for a couple of reasons, he wanted to get off the Cialis. And then he was realizing that he was no longer waking up with morning erection. So he was very concerned. And I think the incorrect or wrong response for me would be like, oh, don't worry about it. Just take the Cialis. He wants to understand what's going on. So I recommended that he get this ring so he can say, okay, he might not be waking up with morning erections, but let's see what's happening with his erections when he's sleeping. It's so often that we ask our patients, are you waking up with morning or nighttime erections? If our patients are sleeping, who knows what's happening with their penis? So this really is like an EKG for the penis that provides real-time objective data on the plumbing. And for a lot of us, I look at it like in a urology clinic. If we want to understand someone's urinary function, we could easily get a uroflow. They pee into a funnel. We can see a graph. It looks like a nice bell-shaped curve. It takes us 5 seconds to be reassured. What do we have that can provide us real reassurance when it comes to the penis? Now we essentially have a uroflow for the penis.
Yeah. That's amazing. I love that. I've seen them at the SMS conventions and I've talked to them a little bit, but hearing the way that you describe it is just phenomenal. Are these a high price point? Are they affordable, covered by like a FSA or HSA?
Yeah, so great question. So this product here, the Max PR, is $60.
Okay.
And they do have sleeves. Like you don't want to overstretch it. And they do the devices do come with like an extra sleeve in case it does tear, but they are very good quality. So this one is $60. And then this one is, the price point is $275. So it's really on a similar price range as a lot of the other wearable devices that people are using. And And, the other question too that a lot of people ask is like, what are the top 5 foods that will improve my erections? What's the impact of gummies on erections? What's the impact of vaping on
Yeah.
erections? Like, we have some data to tell us the impact of nicotine, and we
Right.
have some data to tell us that an anti-inflammatory nutrition plan is going to be helpful for erections. But we actually don't have a lot of data to answer the real life questions of
Right.
everyday people. And a
Yeah.
lot of the nutrition studies are, based on recall, and it's hard to really tease out the nutrition piece.
Sure.
So I encourage my patients to be their own experiment. I could tell them all day long nicotine is bad, but maybe for them it doesn't impact their erections. Or maybe they need to see for themselves rather than me just telling them.
Yeah.
Maybe they need to see what this essentially, EKG shows on their penis that will help them actually change behavior.
Yeah.
Lifestyle modification is first line therapy for every single condition that we treat in healthcare. But we don't really ever get taught how do we actually help our patients change their lifestyle
Right.
in a way that's not us being, very parental.
Right.
And part of that is patients need real time feedback. So devices like this can provide that information.
Yeah, that's phenomenal. I love that. And I can imagine some of my patients how much that would help them. Like you said, if they smoke one night and they don't smoke the next, do they take their gummy one night? Do they not? And you just put this thing on and it's going to give you the information. That's so amazing. I love that.
Yeah. Now, the more data someone collects, the better, because there is a lot of variability in nocturnal erections. And we
Yeah.
always try to separate what is the impact of a hamburger? What is the impact of, one, e-cigarette? We
Yeah.
are very complex people. So it is difficult to
Yeah.
completely separate ourselves and identify one factor. So the more data someone has, the better. And that will help account for some of that variability. The other way I think this can be helpful is there are a lot of medications that will obviously impact erectile function. And there are some medications that people take that, based on research and when you look online, they're not listed as being some of the medications that have a high risk of ED. But I've had plenty of patients tell me about medications that wouldn't even cross my mind as having an impact, but they can look at this and they can see in real time what the impact is. So
Yeah.
that can help educate patients where they can then get that data to then go to their prescribing provider and say, look, I have data to say that this does impact my erections. Might we try another medication? The
Yeah.
other population where I think it can be particularly helpful is after prostate cancer surgery. Because, erections are really going to be at their worst about 3 months after prostate cancer surgery. And it's a long haul for patients to recover, and they can really take up to 2 years for their nerves to recover. So it can be helpful for people to wear this during their recovery, because when they start seeing the blip, that their line is no longer a flat line, it is amazing what that can do for someone's self-confidence and psyche to see objectively that they are recovering.
Yeah, absolutely. I have a lot of post-prostatectomy patients who really struggle with ED despite doing the, penile rehab and pelvic floor physical therapy. And yeah, something like this would be so encouraging because they get so discouraged. They think that it's never going to come back because it's been 6 months and there's no improvement. But like you said, if they're sleeping, they don't know that there's a little bit of extra blood flow or something going on.
Exactly. And then for our patients that we have on a penile rehab protocol, let's say with something like a vacuum erection device, our patients might be asking us, well, at what point can I stop using a vacuum pump? And so if they start getting some of those nighttime erections and they're exercising their penis at night, that could be an indicator that maybe they don't need to use the vacuum pump anymore.
Yeah. Yeah, for sure. I think it's so interesting to say exercising the penis because it is really one of those body parts that if you don't use it, you lose it. Like you can lose girth, you can lose length. And I don't think that enough men understand that.
Yeah, absolutely. And I think too, when we think about how men and women engage in the healthcare system, we as women, we have milestones that necessitate that we go in to see a doctor starting when we're very young. We start menstruating, we got to get our pap smear, we see a gynecologist. If we have children, we go back in. There really aren't any milestones in a man's life other than when he has real problems. So I was kind of brainstorming the other day, what might a milestone be in a man's life that tells him maybe I should engage in the healthcare system? And for some men, it could be understanding what's happening with my erections,
Yeah.
because that could be an early indicator of something else going on and could prompt some guys to actually seek healthcare earlier on. But
Yeah.
that means that we as healthcare providers have to be better about engaging with these men, because there aren't really any healthcare providers who have any mandatory training in men's health. So the
Right.
onus is also on us that if a young man comes in to see us and says, I am concerned about my nighttime or morning erections, we need to take that seriously and actually
Yeah.
look into it further. It does put a lot of onus on us in healthcare.
Yeah, I agree. In fact, my brother-in-law, who he knows I tell this story of him, so it's fine. But he called me one night and was like, "Steph, something's wrong. Like, it's not working right now." And so he, we talked through the issues, and he hadn't been seen by anybody in so many years, and so we were able to get to the point where he went in for a full physical, and he's fine, and it was just a blip on his radar, and he had a very stressful few months, and that was affecting him. But like you said, they don't have something that necessarily will catch them to go and get seen. But because I was able to say, hey, this could be related to something else that's more significant, but you think it's the most significant because it's your penis. And so, he went in for his full physical. And so it's a really great way to kind of tell them that there might be something more going on.
Yeah. Or even more importantly, like provide reassurance and
Yeah.
peace of mind, which peace of mind, especially when it comes to health, that is priceless. You cannot put a price on peace of mind.
Yeah, absolutely. Absolutely. All right. What's next?
All
What
right,
else
let's
you
see what
got
else
for
we
us?
got. All right. So this next product is by a company called Mystery Vibe. So
Okay.
it is an erection ring and it also vibrates. And I had a patient recently who he had prostate cancer. He's post, removal of his prostate. And he actually recommended I look into this because he was actually putting this around his penis and
Hmm.
said it helped with arousal. And he felt like it was actually improving his erections outside of even using this device. So I
Wow.
immediately reached out to the company Mystery Vibe. I know the guy who runs the company, and I said, "What's the deal with this? Do you have any research on the product?" And they actually have some research to support the use of this product. So, what I love about the companies that I've discussed so far is there's not a lot of research and evidence in the sexual wellness space. So a lot of the companies that I talk about and a lot of the products that I recommend to patients are the few products that actually have people supporting them and doing research on their use. So Mystery Vibe is one of those companies that's really leading the field as well. And so this again is an erection ring that vibrates and can help with arousal as well. We oftentimes think about vibrators only for women, but vibration can help reduce pain. It can increase stimulation, arousal, and blood flow. So
Yeah.
on that note, I have another patient who is using a device like this. So this is the Magic Wand, and this
My
is a
favorite.
really good device. I know it's like it is the original gangster.
Yes.
So this device, a lot of women really like this device. You and I, we can say we also really like
Yes.
this device.
100%.
So he actually got this device for himself.
Okay.
And what he will do is he will just put it on the penis in different areas. And he says it feels amazing. So
Good.
I've had other patients also use vibration on the penis, and they will tell me it does nothing for them.
Okay.
So that's fine. My message here is not that every man and woman should get a vibrator. Everyone's a
Yeah.
little bit different, and they're not going to work for everyone. But the first product that someone gets may not be the one that does it for them either, because they are also very different. And I don't entirely know how to explain it, but for those of us who have tried a lot of different products, there are some that hit the spot and there are others that don't. And I don't know why that is. And sometimes it just has to do with, exactly how the product is designed with the configuration. Sometimes it has to do with the power of the vibration, the frequency of the vibration. All those different things can play a role. So I think, as people get older, it can be fun to kind of explore some of these sensations, understanding that not all sensations will lead to an orgasm.
Yeah, for sure. And I think one of the reasons I like the Magic Wand is it does have such a long handle, so you don't have to try and construct yourself into weird positions just to get to the right spot.
Exactly.
Now, do you have patients that, your male patients that like to have vibration in like the taint area that can get to the prostate?
Yeah, absolutely. And this is where the conversation is really key when it comes to education, because none of my patients will bring that up.
Yeah.
And so it's really me explaining to them the neuroanatomy of the
Yeah.
pelvis, and that where someone experiences pleasure has nothing to do with the people with whom they are attracted to. And I think people know that, but I think some people really need to hear that information.
Yeah.
And so, one product here, and this product is by WeVibe.
Okay.
So this is a prostate massager. So this part would go in the rectum and it is adjustable to hit that spot. And this part here would vibrate the perineum.
Okay.
So what I recommend for anyone who's going to use a product that they put in the rectum, make sure it has a flared base so
Yes.
it does not get stuck inside.
Yeah.
But what I also like just about different vibrators, because someone may not know if they like that sensation, and maybe going in with something like this may be a little bit too aggressive if they
Yeah.
haven't explored that area before. So that's where I think vibrators like this, where they can just put it in the perineum, rest
Yeah.
it on that spot, not going inside or anything, to see, do I like it? So if they can explore with a vibrator in
Hmm.
different areas of their body and they can understand where they enjoy vibration, then the
Yeah.
next step would be to figure out what product will target that area the best.
Yeah. That's a great point.
Another product that is very helpful and can really take men from purpose to pleasure is the Intimate Rose vibrating one. Now, this one in particular doesn't vibrate. This is a non vibrating pelvic one by Intimate Rose. And this can actually be used for men and women. So,
Okay.
this part would go in the vagina, this part would go in the rectum. And I see a lot of men who have very obvious pelvic floor dysfunction. They have,
Yeah.
scrotal content pain, they have pain with orgasm or ejaculation, they have urinary symptoms, constipation, you name it. We all see those patients. And so that's where I might introduce a product like this. And I might say, you're really tender in your rectal area. I want you to meet with a pelvic physical therapist. They're going to walk you through how to actually use a device like this. And then what I find in some men is that they go from having pain to then they're in a space of neutrality to then
Hmm.
they realize, oh, that vibration and pressure actually feels good. And
Yeah.
that is really that progression between, from purpose to pleasure. And I think a product like this that we medicalize for pelvic health,
Yeah.
they can understand that, oh, that area actually feels good, and it can kind of help them enter into that space a little bit. And maybe another product they get is something like this that is a little bit more on the pleasure side.
Yeah. Yeah, that's fantastic. Yeah, I've sent a lot of guys to pelvic floor physical therapy for pelvic tightness. Especially, I work in an area that there's a lot of engineers. I work by NSA. And engineers, man, they carry their tension in their pelvis. So I send a lot of them there just to loosen up and be able to get to pleasure, like you're saying.
Absolutely. Now, this is, I want to show another product. It would not be what I would consider to be like a sexual wellness product, but is in this whole concept of kind of like wearable devices and
Mhm.
making medical things fun. All right. So let's, on the concept or on the topic of pelvic floor, how do we make pelvic floor fun?
Yeah.
We can tell our patients to do Kegel exercises all day, every day, but
Yeah.
it's a little bit tedious. It does require some work. So I had a patient recently, actually one of the patients that I spoke about earlier who had his prostate removed for prostate cancer, and he was using this product called Kegel, and you sit on it kind of like a bike seat, and it connects to the smartphone, and you
Okay.
can play games like ping pong while doing pelvic floor exercises. So
That's
he
so
thought this
cool.
was really fun.
Yeah.
And then there's one actually for women as well. Like a woman could also use this. You
Sure.
sit on this in the perineum. But the better one for women, if someone is open to it, would be one that actually goes in the vagina.
Okay.
Now, so this can help with compliance and make it a little bit more fun to do the exercises. Just the one sort of limitation is that it doesn't assess how good the muscle contractions are, right?
Yeah.
So it really should be used in combination with someone seeing like a pelvic
Yeah.
specialist to make sure they're doing it correctly. And then once they know how to do those exercises, then using something like this can really help gamify that experience.
Yeah. What a great invention. I had not seen that one.
Yeah, I recently heard about it, so I immediately reached out to the company and I was like, you have to send me some demos so I can try this out.
Yeah, that's fantastic. These are such great tools.
Yeah, I hope that, it's really not part of any of our training.
Yeah.
And my hope for people is that we can be just as excited about some of these therapies that don't require a prescription, that don't
Yeah.
require surgery, like just as excited as we get about new pharmaceuticals and new
Yeah.
medical technologies in the operating room. Because ultimately, what a lot of our patients want are non invasive therapies that they can use in the comfort of their home that are
Yeah.
safe and don't have side effects. So I really do think it is our job, especially as sexual medicine specialists.
Mhm.
Like we should be introducing these technologies to our patients and
Yeah.
not relying on our patients to get their information from online and kind of guessing their way through it. But it
Yeah.
is challenging because there are a lot of products out there. So,
Yeah.
like, how might a healthcare provider even begin with familiarizing themselves with these products?
Mhm.
One is when people go to scientific meetings, it's just kind of like stopping by the booths and seeing what products people have available.
Yeah.
Is when our patients tell us, "Oh, I tried this product," is
Mhm.
we should ask them, "Did you like it? Would you recommend it?" And if they say yes, just reach out to the company and set up a meeting and ask them to send you a demo so you can try it and have your patients try it. There's not a
Yeah.
single company, my entire room back here, these are all essentially demo products that
Yeah.
companies have sent me for free because I've reached out and I said, I would love to learn more about your product and show it to my patients. Can you send me some? And for
Yeah.
the products that I can try, I say, can you send me one for home? Can you send me one for the office? Right.
Yes.
So I can personally try it myself. But
Yeah.
it's really not hard to do, but it does take some thought and strategy.
Yeah.
And it does take time, and I fully acknowledge that we are all very busy, and time is a limited resource.
Yeah, absolutely. And so many of us now have either an HSA or an FSA account that it's really not going to break the bank to go and get a $200 FirmTech or a vibrator or such because you can use them, especially, if you're using it for a medical reason, you can use those accounts.
Yes, absolutely. Yeah.
Yeah.
And a lot of these companies are really putting in the time and effort to go through the FDA. So, I
Yeah.
imagine in the next like 1 to 5 years, these products will be cleared by the FDA and maybe be a little bit easier to get through insurance as well.
Yeah. Yeah. That'd be fantastic as well. I
Mhm.
think we have time for one more, maybe. Do you have any other ones that you want to show off tonight?
Yeah, so let's talk about maybe a little bit like on the female side
Yeah.
and what couples might use. And so whenever I bring someone in this room and they say, "Well, what vibrator should I get? What's the hot ticket? What's the hot
Yeah.
ticket seller?" It's not that easy to answer that question because it just depends on like, do you want to use it by yourself with your partner? Do you want
Right.
it to replace the penis, be used with the penis? So many follow-up questions there.
Yes, for sure.
So this product here is really like for a couples vibrator, although it can be used solo. This part right here would go in the vagina and really stimulate what we call that clitoral urethral complex or the G spot. And then this would sit right on the clitoris. The nice
Okay.
thing about this device by WeVibe is it's hands-free.
Mhm.
It can be put in the woman, and let's say just during foreplay, or let's say the woman's on the couch, the husband's doing the dishes, right? We can all dream. Maybe he's controlling this with a remote, and that's part of the
Okay.
foreplay, right? This can also be used during sex so that you don't have to actually put like a separate product and hold it on the clitoris. This can go
Okay.
inside and the penis would just go down here. So this can be
Perfect.
very valuable. Now it's important to understand the anatomy of the man and the woman if we're talking about a heterosexual couple, because depending on the size of the penis and the
Mhm.
size of the vagina, you might need to customize the inside part of
Sure.
this. If the vagina is on the smaller side, the penis is on the larger side, there's only so much it's going to fit in the vaginal canal. So they
Right.
do have different iterations where they have more narrow or thinner parts that would go inside the vagina.
Okay.
Then we have, vibration can be extremely helpful for women to increase stimulation. As we get older, both men and women, it just takes more stimulation oftentimes to reach climax. And sometimes maybe it typically takes 20 or 30 minutes. Maybe, there is a time and a place for a quickie. And
Yeah.
sometimes you're just tired and you're like, I just don't want to put in the work for 20 or 30 minutes to get there. That's where vibration can really be helpful. But part of that is, let's say a woman takes 20 or 30 minutes to get aroused. What are other ways that she could get aroused, that might be, not considered right now? So one would be the womanizer. This actually connects to like a standard shower head, or is like a standard shower head, can replace one. You can shower with this. It will still wash the hair just fine.
Yeah.
But it was actually designed for the vulva. I have not tried this before, but I know like one of the settings kind of goes like this, and I've heard it feels amazing. So a lot of people will actually use the shower head in their
Yep.
standard shower, and that can be very helpful. But they also have ones that are specifically designed for the vulva. And then lastly, we'll end on, actually, I want to talk about two more products
Yeah.
here real quick. So this product here is what we would call a clitoral suction device.
Okay.
And it's a bit of a misnomer because it doesn't actually suck on the tissue. It provides these pressure air waves, which is
Okay.
a very different sensation compared to a standard vibrator.
Yes.
Now, I love vibrators, but vibrators can be desensitizing sometimes.
Mm-hmm.
And that's how they can, like, in part help with pelvic pain. But if you put a vibrator on, like, the clitoris for too long, especially at just like a standard vibrational setting, it can numb the tissue temporarily. So there are some women that don't like vibration for that reason, or even despite using a vibrator, are unable to reach climax. That's where clitoral suction devices can be really helpful for women who are unable to climax despite using a vibrator. It's a very different sensation. It is quite intense. So for some people, it might get them to climax within 2 minutes.
Mm-hmm.
And that could be really great on some occasions. And then maybe on other occasions, the woman says, I don't want to climax within 2 minutes. I want to draw this out a little bit.
Yeah.
So my message there is a time and a place for everything. Sometimes we want it quick. Sometimes we want 5 minutes, 10 minutes, 20 minutes, 30 minutes. So we have to build this whole toolbox or bookshelf, shall we say, ahead of time. So we kind of have all those tools in our armamentarium rather than deciding on a Friday, what type of sex do I want to have, and then not being able to have it. I encourage my patients to define the type of sex you want to have in a given moment. And that's what is going to call out whether you use a tool, you don't use a tool, or you use a combination. And that type of sex can vary every day if they want to. Oftentimes in healthcare, we say, okay, well, I'm going to put you on Cialis. You're going to try this one medication for 3 months, and then we'll follow up. But the reality is our patients who are having really great sex are not just using one tool. They are combining tools.
Yeah. Yeah, I absolutely agree. I think it's phenomenal. And, hopefully we get to the point in society where we don't have to tell our best friend where our box is so that if we die one day, she's got to get rid of it for us. My best friend knows where my box is, but now I have a sex podcast. So I feel like everyone just expects me to have stuff anyway.
That is quite a funny comment because I do have a lot of patients that are just nervous about getting something because they're like, look, there's no area in my house that is safe from my kids. I'm like, you don't have a single area? And they're like, I don't have a single area. Yeah. That's where getting a product that doesn't look like a sex toy can actually be very helpful. So I have two quick examples here. One is this one right here that kind of looks like a bullet vibrator, and it looks like a lipstick. So no one would know that this is a vibrator, but it is a vibrator. The other one is like this, like no one would know what this is, and it's a vibrator, and you can travel with it. So if someone found this, I don't think you would be like, making your friend come and like destroy everything,
Not too mortifying.
Not too mortifying. But I also think like, I try to tell my patients, and I don't try to make a joke out of what their concerns are, but like if I had a bunch of toys at home, which by the way, of course I do, like if someone found them, maybe my hope is that they would be like, she was having some good sex.
Yeah.
Like, wow, she was having a lot of fun.
Yeah, exactly.
My hope.
Yes.
Is that would be the impression.
Absolutely.
So the last thing that I want to discuss here is perhaps one of the more taboo topics, which are strap-on devices.
Yeah.
And this device right here, I mean, it looks extremely realistic. It's made out of flesh-like material. The company is called Blissful Creations. And when we talk about strap-ons or harnesses, that is definitely not something that we discuss in medical school, or any sort of healthcare school.
Right.
But I had a patient come in and he wanted to discuss options for penile enhancement. And he said that he had tried penile sleeves before from a couple different companies. And I asked him, I said, does it even feel good, or does it feel like a really thick condom? And he said, no, it actually feels really great. And it allows him to have a different length and girth experience on any given day of the week, depending on what he and his partner feel like they want to enjoy. And the penile enhancement space is a very polarizing space. So we do have safe options now for girth and length enhancing, but there are a lot of other options that can be disfiguring for some people. So I think devices like this, where they can just see what it feels like on a Wednesday, are really good options. So this device right here was created by an artist, actually. He's a sculptor, and he changed his business during like the COVID time to get into this space. And he decided, well, I'm going to use all my expertise that I had in sculpting with materials and molding to create these penile sleeves. And so they roll up on the penis. Okay, so you would put the penis in here, and the penis, this is, they have support devices as well as like girth and length devices. But some of these devices actually are rigid from here to here. So they would just customize the size from like here to here, depending on the size of the penis. And so a person could actually put this on when he's fully flaccid and still penetrate with this on. So I think about our guys who, let's say, are post-prostatectomy. They're not getting erections yet, but maybe they want to, we could have them do mutual masturbation, but maybe they just like the positioning of being face to face with their partner and having that eye to eye contact and intimacy. Yeah. Using something like this can be very helpful for maintaining that intimacy and that positioning. And it doesn't require a strap. So they use fancy technology where it has suction in here. So the person would just put it on and it will not come off until he actually takes it off.
That's amazing. I love that.
Yeah. So really cool technology these days in the space for both men and women. And also, for some patients, if they identify as being transgender and they have, or at any sort of stage of their transition, a lot of these products that we discussed today can be helpful for people with really any type of genital anatomy.
Yeah. No, this is fantastic. It's a phenomenal discussion. And I love that there is all this innovative technology coming out in this sexual wellness area. Definitely an amazing show today. Thank you so much for coming on.
You're welcome. And the nice thing about all these products is not a single one requires a prescription.
Fantastic.
So all of them can be purchased, online. And, even the devices that capture the data with this tech ring right here, they make the information palatable so that a person can understand the information even outside of needing anything interpreted by a physician. So a physician is not required to really understand the results of that technology.
Yeah, I love that. This is such an amazing and fascinating side of medicine and sexual wellness, which I just absolutely love. Thank you so much, Dr. Pearlman, for being on here.
Thank you so much for having me, Stephanie.
All right, have a great day, everybody. We'll see you next time on Between the Sheets. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthe.sheets@gmail.com. That's all one word, podcastbetweenthe.sheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics Between the Sheets.